Welcome back to Elder Care Answers. I'm Doreen Seamon, and we're back with Lincoln Kincaid, the owner of Dynamic Physical Therapy. We've been discussing how physical therapy can help us maintain our mobility so we can enjoy the best quality of life possible. Just before our break, Lincoln, you mentioned that physical therapy can help us with our activities of daily living. Can you tell us more about that?
An activity of daily living is any one of a number of activities that we have to perform to be able to live and to function safely in our homes. These activities include light housekeeping, meal preparation, making our beds, toileting, and bathing, just to name a few.
Lincoln, I can see why maintaining strength and balance is so important. In my experience working with my clients, the inability to perform some of these basic activities of daily living often lead to their loss of independent living. If somebody's watching this show right now and they realize physical therapy may help them improve or maintain their independence, why should they call Dynamic Physical Therapy for help?
Doreen, at Dynamic Physical Therapy, we take great pride in being the hands-on specialist in our field. We spend a lot of time with each and every client that comes through our door. We offer a level of hands-on care that just can't be matched. We have a very low patient-to-therapist ratio, which allows us to spend a lot of time working one-on-one with our patients to help them meet the goals that are most important to them.
And how do we establish those goals? Do you determine them?
We listen to our patients. They come in, they tell us what's important to them, and then we look at the physical impairments that prevent them from being able to perform these activities. For many, they might have a goal of being able to tie their shoes independently. For others, they might have a goal of being able to go for a walk with their grandchildren. But more often than not, their goal is directly related to their ability to maintain their independent living in their own home for years to come.
Wow. And now I can see why your business has grown so quickly over the past 7 years. Clearly, you're treating your clients with the care and compassion they need. Lincoln, I know many of us get nervous about new things. If somebody was to come to Dynamic Physical Therapy, what should they expect at their first visit?
The first visit is really where our therapists get to know our patients. We perform a thorough physical evaluation. We find out what activities our clients are not able to perform, and then we look specifically at what lack of strength or what lack of movement at a particular joint does not allow them to perform this activity. And then together, we establish a plan of care that will allow our patients to regain or retain the level of independence that is so important to them.
Well, but besides improving strength and decreasing risk of falls, are there other conditions that could benefit from physical therapy?
Yes, we commonly treat patients with osteoarthritis, with osteoporosis, neck pain, back pain, shoulder pain, just to name a few. We also have specialists who are prepared to treat patients with dizziness related to problems in their inner ear.
Lincoln, what are some other ways you can help your patients?
We help our patients identify potential risk factors in their home, and we help our clients figure out how to use their body and position themselves while performing any given activity to prevent the possibility of a future injury.
Wonderful. Now, I know you have 7 locations in North Central West Virginia. Can you tell us where they're all located?
Yes, we have locations in Westover, Morgantown, Saberton, Fairmont, Bridgeport, Jane Lew, and now 100.
It sounds like no matter where our viewers are located, there's a Dynamic Physical Therapy nearby. Now, what about the cost? Will insurance cover the care costs for physical therapy?
Usually we find that insurances do pay for physical therapy. Medicare pays for 80% of the cost of a visit, but most of our clients have a secondary insurance which will pick up the remaining 20%.
Now, Lincoln, tell me what led you to work in physical therapy and open a business here in North Central West Virginia?
I came to Morgantown in 1991 to attend WVU. I received a scholarship through WVU hospitals, and I remained in the area working for hospital-based therapy services for a couple of years following school. Having been born and raised in West Virginia, I have a love and a genuine concern for the people in this great state, and as long as I'm a physical therapist, we're going to continue to treat the patients of this area.
Lincoln, thank you so much for helping us understand how physical therapy can be a key factor to our independence and quality of life. after talking with you today, I can see such a similarity between physical therapy and elder care planning, because they both help us improve our quality of life and maintain our independence. But obviously, those who seek help sooner rather than later have a much better outcome, don't they?
Absolutely. If somebody has a problem, we want to get to them as quickly as possible, because the sooner we can begin treatment, the sooner they're going to get better.
And can you tell us one more time how the viewers can contact Dynamic Physical Therapy for their own personal evaluation?
Yes. Our viewers can go directly to our website, which is dynamicpt.org, or they can call our main office at 304-225-5222.
Great. And if you didn't catch the phone numbers for either my law office or Dynamic Physical Therapy, we'll show them again at the end of the show. So grab your pencil and paper and stay tuned to Elder Care Answers. We'll be right back with Michelle Hopkins of Mon General's Morgantown Hospice.